There's a couple key things to keep in mind when you're taking before and after cases for your website, and this next video will demonstrate exactly what we're looking for picture content, and just things to keep in the back of your mind when you're taking your next set of pictures for a great case you worked on.
So a couple thoughts on before and after cases. Ideally for before and after cases, we want to have a very clear high resolution shot of the smile. We don't really need to get into the technical details because patients aren't so aware of that. If someone, and this is a great example, if somebody's in the mirror, they just had an accident or trauma, and they're looking at this picture of their tooth knocked out, or they have an unsightly gap, or their teeth are yellow, you want to be able to paint a picture of what it's going to look like afterwards. They're not so concerned with how they get there. We want to present what the final effect is going to be, and this is a good illustration of this. I'll show you guys a couple more. Just a broken tooth, and it looks pretty good. You can't really even tell, at least to me as a casual observer, that there was any dental surgery at all. And here's another example, another missing tooth, and this too. Now these specific cases are for trauma, but you could understand how this could go with teeth whitening or Invisalign or any cosmetic procedure as well. We just want to show the before and the after and highlight your work. If you feel like other people do it better than you, you're not the best cosmetic dentist, don't worry about that. You're going to have a much better eye for this kind of thing than your patients are. The patients want it to look good. Some people want it to look perfect, and they're going to hunt around for the absolute best person they can possibly find and pay whatever it takes. Very few patients are going to do that. They want it to look good. And you can probably do even better than that. So I would encourage people to not be too critical of your own work, to put stuff up there and leave that as motivation to do better work in the future, and then replace it down the road or add to it. Now, on the other hand, even though the work may be good, the composition of pictures is important. And what we don't want to have are cheek spreaders, gauze, blood. These don't present a positive image to patients, and this looks rather uncomfortable. All these kind of medieval torture device looking things in people's mouths. We don't want that. Just take them out and shoot it as best you can. Have your patient give a little bit of a wider smile, or if you really need to use cheek spreaders to get the detail, try to crop it as best you can. This could even be cropped a little tighter. We don't really need to see the lips or all the gums in there to really get the detail of what we did. And we need higher quality pictures. What I'm afraid of is when people see images like this, the first thing that actually comes to my mind is the Predator from all those Arnold Schwarzenegger movies. We don't want to associate any kind of negative imagery with our work. So remember, keep high quality pictures, no tools, no blood, no gauze. Focus on the results. Make sure that people are smiling if possible. Get somebody who's clean shaven. But overall, this is kind of what you want to avoid, and something more like this is what you're going for. I hope this helps.